Hello everyone, this is Alex Kuzma from Loyola University Medical Center. I'm here to talk to you about septic arthritis versus transient synovitis. Children often develop hip pain for no apparent reason. When this happens, your doctor needs to distinguish between two important causes: septic arthritis, in other words, an infection of the hip joint, versus transient synovitis, also known as toxic synovitis, in other words, an inflammation of the hip joint without an infection. Septic arthritis is more serious and needs urgent surgery to prevent long-term damage. It's actually very common for all of us to have small amounts of bacteria in your blood, and usually your body's immune system can handle this without problem. However, with some bad luck, that bacteria can settle into a bone or joint and start to grow, causing an infection. Unfortunately, children are particularly susceptible to this type of infection. Transient synovitis typically gets better with anti-inflammatories like ibuprofen and does not need surgery. The pain is typically better in a couple days, but can take a couple weeks to improve. Transient synovitis often happens after a child has a respiratory virus like a cough, sore throat, or even a runny nose. Children with septic arthritis typically have higher fevers and are more likely to stop walking from the pain. However, we need more information to make the diagnosis, so we also get labs, x-rays, and an ultrasound to see if the hip has fluid inside of it. Sometimes an MRI is also helpful in distinguishing the cause of your child's hip pain. If these tests are concerning for septic arthritis, the infection of the hip joint, your care team will usually recommend aspirating the hip, which means sedating the patient and using a needle to draw fluid out of the hip joint. The lab can then look at the fluid to better distinguish between septic arthritis and transient synovitis. If it still looks like septic arthritis, your surgeon will recommend performing a procedure to decompress the hip joint by opening it up and washing it out. After surgery, you'll stay in the hospital for at least several days so that the care team can make sure you're getting better. This will include getting labs on a regular basis to make sure they're improving, especially an inflammatory marker called CRP or C-reactive protein. Your doctor will also work with the lab to make sure that you're on the right antibiotics before going home. In rare cases, multiple surgeries may be necessary to wash out the hip joint before it improves. In other rare cases, there may be an infection near the hip that is not actually inside the joint itself. In other words, not technically septic arthritis nor transient synovitis. In these cases, surgery may still be necessary, and your surgeon will explain the particulars of your child's condition. I'd like to give a big thank you to the Pediatric Orthopaedic Society of North America, as well as to OrthoKids.org, where you can find more information about septic arthritis versus transient synovitis.